This is Dr. Mounam Chattopadhyay. I am an endocrinologist from Kolkata. I have been practicing endocrinology since last 5 years, and I have seen a lots of patients with their metabolic problems as well as hypertension. Today, I'll be going to discuss mainly about high blood pressure and how to prevent it. First of all, we have to know that what is blood pressure. Actually, as we all know, basically each time our heart beats, it pumps the blood into the blood vessel. And while flowing, this flowing blood exerts a lateral pressure on the vessel wall. And that is actually known as blood pressure. High blood pressure generally develops over time. It can happen due to several reasons like essential hypertension, which is idiopathic and it's inherited at times. And there are some secondary causes of hypertension, mostly lifestyle related causes like sedentary habits, obesity, smoking, high alcohol consumption. With age, patient can have hypertension. If you have family history, you can have hypertension. Excess salt intake is known to be an important cause of hypertension. Not eating enough foods with potassium can raise your blood pressure level. Eating processed foods or fatty foods that increases your blood pressure level. Another important and often neglected factor is lack of proper sleep and increasing in psychological stress. Now, the question comes, how does a patient with hypertension manifest? Unfortunately, there are not a single telltale sign of hypertension. It's a silent killer, and there are non-specific signs and symptoms like lethargy, malaise, heaviness in head, throbbing headaches, and all. And the hypertension, if not managed early, can lead to end organ damage and complications like kidney failure, stroke, eye damage, blindness, etc. So acute diagnosis and prompt treatment is of utmost importance. Now, fortunately, high blood pressure can easily be diagnosed with a sphygmomanometer. There are actually, when the doctor writes a blood pressure recording in a prescription, there are two parts of the reading. The upper number, the upper digit figure is called systolic blood pressure, and the lower figure is called diastolic blood pressure. It's normally said that 120 upon 80 and the unit is millimeter of mercury is the normal blood pressure level. So if blood pressure is persistently elevated above 140 upon 90 millimeter of mercury, then the person is said to have hypertension. Now, the risk can be prevented by mitigating the stress risk factors that we have already described, like adopting healthy lifestyle, healthy dietary pattern, regular exercise. You have to quit smoking and alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicine. Now, coming to one by one, during regular physical activity, it's mainly we emphasize on regular aerobic physical activity like walking and running. It makes the person's heart stronger. If one have a strong and healthy heart, it can pump more blood into the circulation. So if heart has to work less to pump, the force on the blood vessel will automatically decrease, and this will eventually lower the blood pressure. Regular exercise also help you maintain a healthy body weight, which in my opinion is one of the most important factors in controlling high blood pressure, and one should aim for at least 30 minutes of regular aerobic physical activity on most days of the week. Diet also plays important role in controlling blood pressure. A diet with high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern that's known as DASH diet. DASH stands for Dietary Approaches to Stop Hypertension Diet. Eating a DASH diet that's rich in whole grains, fruits, vegetables, low-fat dairy products, and skims on saturated fat, cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if you already have hypertension. Reducing sodium in your diet is one important factor. Don't add salt, just one level teaspoon salt of 2300 milligrams of sodium a day. It's enough. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Regular blood pressure monitoring is one of the most important factors, but it's not always possible for patients to visit doctors and check up their blood pressure regularly. Hence, most often I advise patients on self-monitoring on blood glucose levels. Self-monitoring helps person measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get a more complete view of person's blood pressure readings at different time intervals. Further helps us in better prediction of CV mortality, morbidity, rather than single routine blood pressure office measurement that occurs during clinic visit. Next point, by learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercising, listening to soothing music, focusing on something calm or peaceful, and meditation are one of the most important factors to manage excess psychological stress. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is persistently high above 140 upon 90 millimeter of mercury. Despite controlling the aforementioned risk factor, adherence to medicine is another important part as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit, sound, and healthy life. Adopting a healthy lifestyle can help us enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very, very important in preventing cardiovascular complications. It's very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.